Hey there, in this video, I want to talk about knee replacement. Hi, welcome back. This is Elbu, your exercise physiologist. So, many people think that doing knee replacement is the quickest fix to knee pain, but it's not true. Problem with this is that we are not like cars or any machinery. You just take away part of it, put another part into it, fix it, and then you're okay. It doesn't work that way. We are live tissue, we have live cells. It doesn't work like that, right? So what happened is that knee replacement, it's not recommended for everybody. If you need to go and do it, go ahead, but it requires a series of checks before you are actually suitable for knee replacement, or I will actually advise you to go for knee replacement. Now, the thing is that I've seen so many cases who requires or ask to go for knee replacement, but once there's no pain, they stop thinking about having to do a knee replacement. Now, if you're using pain as a gauge for having knee replacement, because it's giving you a lot of problem, depending on who you see, right? Most people will tell you to go for knee replacement if you are young, if you have no problem, less risk, go for it. It's good for you, right? If you have insurance coverage, go ahead, it's all covered. The thing about this is, like I said earlier on, the recovery period is long. It can take months, it can take half a year, okay? So it's not the quickest fix or the easiest fix because you have pain. What I usually suggest is go and do your rehab because there's less risk, okay? Very less risk involved because you're not cutting yourself up to get the thing replaced and then you're okay. You do your rehab, it may be because of certain weakness, certain imbalance that's causing you the pain, right? Structurally, what you see with x-rays or MRI doesn't tell you much about the function. I'll say this again. Seeing a photo, seeing a picture doesn't much tell you what happens during the process. Okay? For example, if you see a picture of somebody who's smiling, right? It is just on the surface what it looks. You don't know what's behind, right? Same thing, when you see the x-ray, you can see that there's something wrong with the knee that's causing you the pain. Many people, after surgery, after replacement, they still have knee problem. Okay? So are you going to go through that months of torture and then to realize that you actually don't need a knee replacement because it is still going to give you problem? Many people don't like this approach because it's many people don't like to go for rehab because it feels like it's a chore. You got to go through different things. You got to be progressively going back for rehab. Okay, what many people don't tell you is that doing the replacement, you're still gonna go through rehab, right? So instead of going through rehab and then you find yourself no pain, you have to go through prehab to get yourself strong. You go through surgery and then you go for a rehab again. Does that make sense to you? If you can do the prehab, or if you can do the rehab and you have no pain, would you want to go for that prehab surgery and rehab again? It doesn't make sense, right? So please give rehab a try, right? Go and look for somebody that can help you have a better diagnosis and tell you what's going on. Do a series of tests and you're convinced that this may be the root of the problem rather than just replacing the knee. The recovery is going to take very, very long. If pain is your gauge, go ahead and do your rehab. What you see in the MRI doesn't tell you much. It's just telling you that this is now happening, right? This is now causing you the pain. What's happening before that? Why is your knee in a certain angle, or why is your knee rubbing against each other? Why are you seeing bone spurs? Why are you seeing this in the scans? Have you ever thought about that? Right? So go and search online, go and look for the surgery procedure. If somebody is honest enough to tell you, it is the rehab, the surgery, and the rehab. I'm going to say this so many times so that it drills into your head. It actually takes months or half a year. It takes that long. Okay? And a proper rehab can take as short as 2 weeks to 4 weeks, depending on how diligent you are and who you see. Okay? It can take that short. Once you have that root sorted out, once you have no pain, now think again. Is that chip that you see in the X-ray or the MRI still there? It is. Okay? You can't reverse that. That thing is still there. Not just because you feel no pain and it disappears. If you have no pain, go and do an X-ray or an MRI again. You will still see it, but you have no pain now. Now, then do you want to go for a surgery? I'll leave this question to you, because the reason why you're looking at this video is because you have that query, you have that question, you want to know how knee replacement works. Don't just listen to me, go and look for some more people online who's sharing all this experience. Not everybody has got positive outcome, so go and do your search. I recommend rehab first, because once you have no pain, you may not even need surgery. It saves everybody's time, it saves your money, it saves taxpayers' money. Insurance premium is not going to go higher and higher because of all this. Okay, this can in the end solve a lot of issue. Okay, so you actually do play a part. Other than having your knee sorted out, you're actually helping the rest of the people who may actually need surgery, but because of high premiums, they can't do it. Okay, in the long run, it's going to help people. If you don't need it, don't do it. Okay, so that's all I have for you. If you like my video, please don't forget to subscribe, like my videos. Okay, if you have any questions, you can post it in the comment section below. Please take care, and I will see you soon.